Mental retardation. Mental retardation is a condition of incomplete development of the mind, which is specially characterized by impairment of skills manifested during the developmental period, which contribute to the overall level of intelligence, that is, cognitive, language, motor, and social abilities. Mental retardation can occur with or without any other mental or physical disorder. Mental retardation is thus defined in terms of level of performance as well as intelligence. However, mentally retarded individuals can experience the full range of mental disorders, and the prevalence of other mental disorder is at least 3 to 4 times greater in this population than in the general population. Mental retardation occurs among children throughout the world. In its most severe form, it is a source of great hardship to the parents and also a social and economic burden on society. During childhood, individual with a mild degree of intellectual impairment often appears to be normal. Their sub-average intellectual becomes apparent only when difficulty with school homework leads to a diagnostic evaluation. Diagnosis and assessment of mental retardation. The American Psychiatric Society in DSM-4-TR define mental retardation as a significantly sub-average general intellectual functioning, a determinant made with one of several IQ tests with a cutoff score set by DSM-4-TR of approximately 70. Roughly 2% to 3% of the population score at 70 or below on these tests. The American Association on Mental Retardation, which has its own similar definition of mental retardation, has a cutoff score of approximately 70 to 75. The second criteria of both the DSM-4-TR and the AAMR definition for mental retardation calls for concurrent deficits or impairment in adaptive functioning. In other words, scoring approximately 70 or below on an IQ test is not sufficient for a diagnosis of mental retardation. A person must also have deficits in at least 2 of the following skill areas, which are communication, self-care, home living, social and interpersonal skills, academic skills, leisure, work, safety and health. The final criteria for mental retardation is the age of onset. The characteristics below average intellectual and adaptive abilities must be evident before the person is 18. The imprecise definition of mental retardation brings up an important issue. It perhaps more than any of the other disorders is defined by society. Initial diagnosis of mental retardation occurs very frequently at ages 5 to 6. That is almost around the time schooling begins for most children. Peak at the age 15 and drop off sharply after that. During early childhood, individuals with only a mild degree of intellectual impairment, who constitute the vast majority of the mentally retarded, often appears to be normal. Their sub-average intellectual functioning becomes apparent only when difficulties with the school work leads to a diagnostic evaluation. When adequate facilities are available for their education, they can usually master essential school skills and achieve a satisfactory level of socially adaptive behavior. Levels of mental retardation. 4 levels of mental retardations are recognized in DSM-4-TR, each corresponding to a specific range of IQ scores. IQ is not the only source of diagnosis. The person with low IQ scores but adjusting adequately would not be considered to have mental retardation. IQ criteria is applied only after deficits in adaptive have been found. The approach of the American Association on Intellectual and Developmental Disabilities. AAIDD has been in existence since 1876 and has routinely published guidelines for classifying and defining mental retardation that are less focused on identifying the severity of disability and more on determining what steps are necessary to facilitate higher functioning. According to AAIDD, mental retardation or intellectual disability is a disability characterized by significant limitations both in intellectual functioning and in adaptive behavior as expressed in conceptual, social, and practical adaptive skills. This ability originates before age of 18. There are 5 assumptions which are essential to the application of the definition, which are: 1. Limitation in present functioning must be considered within the context of community environments typical of the individual's age, peers, and culture. 2. Valid assessment considers culture and linguistic diversity as well as differences in communication, sensory, motor, and behavioral factors. 3. Within individual, limitations coexist with strengths. 4. An important purpose of describing limitations to develop a profile of needed supports. 5. With appropriate personalized supports over a sustained period, the life functioning of the person with mental retardation generally will improve. Now we have a table number 1, which shows DSM-4TR categories of mental retardation. Persons scoring 50 to 55 to 70 on an IQ test is considered as mild mental retardation. About 85% of all those with IQs of less than 70 are classified as having mild mental retardation. First one in this classification is mild mental retardation, that is persons scoring 50 to 55 to 70 points of IQ. About 85% of all those with IQs of less than 70 are classified as having mild mental retardation. Next in the classification is moderate mental retardation, that is inclusive of the people scoring 35 to 40 to 50 to 55 points of IQ. About 10% of those with IQs of less than 55 are classified as having moderate mental retardation. Next we have severe mental retardation, that is people scoring 20 to 25 to 35 to 40 points of IQ. So for about 3 to 4% of those with IQs less than 40 are classified as having severe mental retardation. Last in the classification we have is profound mental retardation, that is the individuals scoring below 20 to 25 IQ points. About 1 to 2% with IQ less than 25 are classified as having profound mental retardation. Now we will discuss all these categories of mental retardation a bit in detail. So first we discuss mild mental retardation, that is individuals scoring below 70. Mildly retarded individuals constitute the largest number of those diagnosed as mentally retarded. With the help of a large majority of them can adjust socially, master simple occupational and social skills, and become self-supporting persons. They do not show signs of brain pathology or other physical abnormalities, but they require some supervision because they have limited ability to foresee the consequences of their actions. With early diagnosis, special education, parental support, majority of them adjust socially and settle in their occupation and become self-supporting persons. Next is moderate mental retardation, that is people scoring below an IQ of 50 to 55. These individuals are able to master certain skills such as cooking and other skills under some specialized instructions in them. In adult life, they attain intellectual levels similar to those average 4 to 7 years of children. They usually appear to be clumsy and they suffer from bodily deformities and poor motor coordination. They usually appear to be clumsy and they suffer from bodily deformities and poor motor coordination. They could not master academic skills but could learn rudimentary vocational skills. They can be taught to read and write a little and may manage a fair command of spoken language. Their rate of learning is slow. Some of these are aggressive and hostile but are non-threatening. In short, with early diagnosis, parental help, and with adequate training, most of them can achieve partial independence in daily self-care activities and acceptable behavior in a family or other sheltered environment. Next is severe mental retardation, that is individuals scoring below 40 to 35. They would not benefit from academic or vocational instructions. In these individuals, motor and speech development are severely retarded. Sensory and motor handicaps are common. They can develop limited level of personal hygiene and self-care skills, but are always dependent upon others for care. Some of them can perform single occupational tasks under supervision. Profound mental retardation, that is, individuals scoring below an IQ of 20 to 25. Most of them are severely deficient in adaptive behaviors and are unable to master any skills. Severe physical deformities, central nervous system pathology, and retarded growth are typical. Convulsive seizures, mutism, deafness, and other physical abnormalities are also common. These individuals remain in custodial care all their lives. They tend to have poor health, low resistance to diseases, and a short life expectancy. These individuals show a marked impairment of overall intellectual functioning. Etiology of mental retardation. There are literally hundreds of known causes of mental retardation. Some cases of mental retardation occur in association with own organic brain pathology. We will discuss 5 biological conditions that may lead to mental retardation. Genetic or chromosomal influences. Mental retardation, especially mild retardation, tends to run in families. Genetic factors clearly play a role in the etiology of mental retardation. Almost 300 genes have been identified as having the potential to contribute to mental retardation, and it is expected that there are many more. Down syndrome, for example, the most common form of mental retardation, was first identified by the British physician Langdon Down in 1866. Down had tried to develop a classification system for people with mental retardation. This disorder is caused by the presence of an extra 21st chromosome and is therefore sometimes referred to as trisomy 21 or Down syndrome. Here we have a figure which is showing Down syndrome that is caused by the presence of 3 copies of the chromosomes. So for this purpose, you can have a look at these pictures of chromosomes that we have presented you here. The normal complement of chromosome is 23 pairs. In Down syndrome, there are 3 copies of chromosome 21st. People with Down syndrome have characteristic facial features such as short and stocky stature, oval upward slanting eyes, a flat nose, a small mouth with a flat roof, and a short broad hands. About 40% of the children with Down syndrome have heart problems. Tragically, nearly all adults with Down syndrome past the age of 40 show signs of dementia of the Alzheimer's type, a degenerative brain disorder that causes impairment in memory and other cognitive disorders. The incidence of children born with Down syndrome has been tied to maternal age. As the age of the mother increases, so does her chances of having a child with this disorder. A woman with age 20 has 1 in 2000 chances of having a child with this disorder. At the age 35, the risk increases to 1 in 500, and at the age of 45, it increases again to 1 in 18 births. The reason for the rise in incidence with maternal age is not clear. Some suggest that mother ova are all produced in youth. The older ones have been exposed to toxins, radiations, and other harmful substances over longer periods. This exposure may interfere with the normal division of chromosomes, creating an extra 21st chromosome. Others believe the hormonal changes that occur as women age are responsible for this error. Fragile X syndrome is another chromosomal abnormality that may cause the mental retardation. This disorder is caused by the abnormality of the X chromosome, a mutation that makes the tip of the chromosome look as though it were hanging from a thread, giving it the appearance of fragility. Physical symptoms associated with the Fragile X include facial features such as large, underdeveloped ears, a long, thin face. Many people with this Fragile X syndrome have mental retardation. Others have an average IQ but show problems such as learning disabilities, difficulties on neuropsychological tests, and mood disabilities. About a third of children with this syndrome also exhibit autism spectrum behavior. Recessive gene disease. Several hundred recessive gene diseases have been identified. Many of them cause mental retardation. Phenylketonuria is one such recessive gene disease, which is also called PKU. In PKU, an infant without obvious signs of difficulty soon begins to suffer from a deficiency of a liver enzyme, phenylalanine hydroxylase. This enzyme is needed to convert phenylalanine, an amino acid contained in proteins, to tyrosine, an amino acid that is essential for the production of certain hormones such as epinephrine. Because of this deficiency, phenylalanine and its derivatives, phenylpyruvic acid, are not broken down and instead built up in the body's fluids. This builds up eventually damages to the brain. The neuron of the frontal lobes, the site of many important cognitive functions such as decision making, are particularly affected, and mental retardation can be profound. This disorder occurs in about 1 in 12,000 births. If the condition is not detected, the amount of phenylalanine in the blood increases and eventually produces brain damage. This disorder becomes apparent between 6 and 12 months after the birth. Although such symptoms, vomiting, a peculiar odor, infantile eczema, and seizures may occur during early weeks of life. The early detection of this disease can be done by urine examination. The parents are advised to provide a diet low in phenylalanine. They are encouraged to give a special diet to the child. Next causal factor to the mental retardation is infectious diseases. The fetus is at a risk if the mother is caught with infectious diseases such as rubella. This can cause both physical deformities and mental retardation in fetus. The mother may experience slight or no symptoms from the infection, but the effects on the fetus is devastating. Infectious disease can also affect the child's developing brain after birth. Encephalitis and meningococcal meningitis may also cause brain damage and even death if contracted in infancy or early childhood. In adulthood, these infections are less serious. Accidents. In USA, accidents are the leading cause of disabilities and death in children over 1 year of age. Falls, automobile accidents are among the most common in early childhood, may cause head injuries leading to varying degree of mental retardation. Environmental hazards. Several environmental pollutants are implicated in mental retardation. Some pollutants are lead-based paints, smog, and exhaust from automobiles can cause kidney and brain damage. Ignored or neglected infants who are not provided the mental and physical stimulation required for normal development may also suffer from irreversible learning impairments. Children who live in poverty and suffer from malnutrition, unhealthy living conditions, and improper or inadequate medical care are at a higher risk. Psychological and social dimensions. Up to 75% of the cases of mental retardation fall in the mild range and are not associated with the genetic and physical disorders. Children suffering from the familial cultural retardation have thought to have cognitive impairment, and it results from a combination of psychosocial and biological factors. The cultural influences that contribute to this illness includes abuse, neglect, and social deprivation. Now we'll talk about the treatments available for the mental retardation. Though there is no cure available for the mental retardation, but most of the cases can be managed with a lot of care and specialized treatment modalities that are available. So now we'll talk about the treatments that are available for the mental retardation. Direct biological treatment is not a viable option. A number of programs have demonstrated that significant changes in the adaptive capacity of the mentally retarded children are possible through special education and other rehabilitative measures. The degree of change is dependent on individual situation and the level of mental retardation. First one is residential treatment. Serious and systematic attempts have been made to educate these children so that they can acquire competence required to function effectively in the community. People with mental retardation have legal rights to appropriate treatment in the less restrictive place. They are given training under supervision. They are encouraged to participate in the household work. Many of the adults are able to earn and live independently in their own apartments. Others live semi independently, and generally, counselor provides aid in the evening. There is general agreement about what should be taught to people with mental retardation. The controversy in the recent years have been over where they should be taught. Should people with severe retardation be taught in separate rooms specially designed for them, or they should be allowed to work in the shops? Now we have behavioral treatments. People with mental retardation can acquire skills through behavioral techniques to teach such basic self-care as dressing, bathing, feeding, and toileting to people with even the most severe disabilities. People are taught skills so that performance in each step is encouraged by the incentives. Children with severe mental retardation need intensive training to be able to feed, toilet, and groom themselves. Operant conditioning techniques are applied to teach these children. It is used also to reduce inappropriate and self-injurious behaviors. These programs showed consistent improvement in fine motor skills and self-help skills. Cognitive treatment. Many children with mental retardation are unable to use problem-solving strategies. Even when they use it, they are unable to use it effectively. Self-instructional training teaches these children. They were awarded with praise when they solved their problems correctly. A teacher would demonstrate the steps involved in solving a problem. Several studies have demonstrated that even people with severe mental retardation can also learn from the self-instructions as to how to solve a problem. Education and inclusion programming. Educational and training procedures involve personal grooming, social behavior, basic academic skills, and simple occupational skills. Specific skills are divided into simple components that can be learned before more complex behaviors are acquired. Computer-assisted instructions. Computer-assisted instructions are increasingly found in educational and treatment settings of all kinds, and it may be useful to educate the mentally retarded people. The visual and auditory programs of computer attract the children. They can be used to teach mentally retarded children. To summarize, there are various steps that can be taken to treat mental retardation. In early childhood, proper nutrition should be given to the children. Even severely retarded child may improve greatly to a favorable social, emotional, and intellectual environment. Summary. The DSM-4TR continues to include categories of mental retardation based on IQ scores, which are mild, moderate, severe, and profound. The approach of the AAIDD stresses the importance of identifying an individual's strengths and weaknesses. There are a number of known causes of mental retardation, including chromosomal abnormalities, brain injury, infection, and toxins. Environmental influences such as poverty and nutrition are believed to play a part in milder forms of mental retardation. When serious organic brain impairment occurs before the age of 18, the cognitive and behavioral deficits experienced are referred to as mental retardation. Relatively common forms of such mental retardation, which in these cases is normally at least moderate in severity, include Down syndrome, phenylketonuria, and certain cranial anomalies. The organic forms of mental deficits account for only 25% of all cases of mental retardation diagnosis, regardless of the underlying origin of the deficit, are coded on axis 2 of DSM-4TR.